The commencement of clinical practice by the undergraduate dental student will require the performance of therapeutic measures on patients where the management of pain becomes a primary requirement. To accomplish the necessary pain control for operative dentistry and surgical procedures of the soft tissue of the oral cavity, it will be necessary to master the administration of local anesthetic agents. I wish to stress from the very beginning of your training in this area of dentistry that the utilization of local anesthetics represents more than just the mechanical art of sticking a needle into soft tissue. The ability of the practicing dentist to painlessly administer local anesthetics will be one of the strongest attributes he possesses to build a large clinical practice of dentistry. The molding together of clinical knowledge in anatomy and in physiology and pharmacology, coupled with compassion and patience, will be the building block for the success of rendering of local analgesia. The primary purpose of this presentation will be to demonstrate acceptable methods to use for producing topical analgesia of the oral mucous membranes and to demonstrate commonly employed injection techniques for the production of local analgesia of the hard and soft tissues of the mandible and the maxilla. For your clinical cases where local analgesia will be required, you will, by appropriate requisition forms, obtain the necessary materials for topical anesthetic placement. The topical anesthetic material, the syringe and needle, cotton pliers. The placement of topical anesthetics intraorally can be accomplished with dental cotton rolls or cotton tip applicators. A conventional dental cotton roll can be cut in half to make a convenient applicator. A standard dental cotton plier may be used as the cotton carrier. Xylocaine 5% ointment will be used in all cases for topical analgesia. The ointment may be placed on the cotton roll by pressing into the ointment to trap a sufficient layer on the cotton roll. The cotton tip applicator is prepared with ointment in a similar manner. For the actual placement of the topical anesthetic and the injection of a local anesthetic agent into the soft tissue, one thing is imperative to simplify the process. Communicate with your patient as to what you want him to do and anticipate unusual sensations the patient will experience and forewarn him of this. An example of this is as follows. Betty, will you turn your head a little bit towards me like that? I'm going to place a little topical anesthetic onto your gum here. Now open your mouth for me. Keep your head turned towards me. Don't let me turn your head to the side. Close down a little bit further. Fine, just like that. Now close your mouth. Fine, just like that. Close contact of the cotton roll to the mucosa is important. Observe again the manipulation of the cotton pliers and external finger. Now open your mouth once again. To gain close contact of the cotton roll to the mucosa, when the cotton plier grasp is released, come to the bottom of the cotton roll with the tip closed, press it to the mucosa, let your retracting finger come down, your external finger holds the cotton roll into the mucogingival fold, the cotton forceps come out, and you now have good contact to the mucosa. Now open once again, and we will now remove this. One to 2 minutes should be allowed for mucous membrane contact. Burnishing the mucosa with cotton roll prior to removal can aid in penetration of topical anesthetic agent, and thus better topical analgesia. The removal of the cotton roll should therefore be done in this manner. Betty, now open your mouth once again. Let me pull your cheek to the side. I'm now going to rub this onto your gum a little bit. That's fine. Now I'll remove this, and now you may close your mouth. The area is now properly prepared for needle penetration. I will now demonstrate the multiple sites to produce topical analgesia intraorally. Points to notice for each of these sites are verbal commands, head positioning, and tissue retraction. I will now demonstrate the cotton roll placement for the posterior superior alveolar nerve injection. Betty, will you turn your head just a little towards me? Open your mouth. Let me pull your cheek to the side, but don't let me turn your head. Close down just a little bit. Fine. Now close your mouth. I will now demonstrate the cotton roll placement for the middle superior dental nerve injection. Betty, turn your head a little bit towards me. Open your mouth. Keep your head towards me. Don't let me turn your head. This is now placed just forward to the zygomatic process of the maxilla. Now close your mouth. Fine. Now open once again. I will now demonstrate the cotton roll placement for the anterior superior dental nerve injection. Turn your head just a little bit towards me. Open a little bit wider. Relax your lip and cheek. Open a little bit wider. This is now placed in the area opposite the teeth you intend to inject. Now close your mouth. These are topical placements for the left side of the maxilla. Now open your mouth. I will now demonstrate the cotton roll placement for the anterior superior dental nerve, right side. Tip your head back just a little. Relax your cheek. Now open your mouth. I will now demonstrate the cotton roll placement for the middle superior dental nerve injection, right side. Turn your head just a little bit up. Open your mouth, relax your cheek. Fine. Now open your mouth. The demonstration for the posterior superior dental nerve, right side. Tip your head up a little bit, relax your cheek. Don't let me turn your head, bite down further. Fine, now open your mouth. At times it will be advantageous to do a horizontal type of injection with the local anesthetic needle. and you will find it advantageous to place the cotton roll on the opposite side that you wish to infiltrate in this manner. If you wish to infiltrate the left side of the tissue here, place the cotton roll in this manner. Now open your mouth, relax your lip and cheek. Let me lift it up. Place the cotton roll to the opposite side of the midline. This will now produce topical anesthesia to this side so that the needle may be placed in this point and passed horizontally to infiltrate the tissue of the left side. Now open again. If the reverse is desired, place it to the opposite side of the midline so that topical anesthesia will be produced to the left of the midline. The needle can be placed horizontally and passed to this portion of the tissue to produce local analgesia. Now open again. There are three primary nerves to anesthetize in the palatal area of the maxilla. They are the right and left greater palatine nerves supplying the posterior aspect of the hard palate, and the long sphenopalatine or nasopalatine nerves supplying the anterior portion of the palate. The palatine nerves come through the right and left greater palatine foramen. The long sphenopalatine nerve emerges through the incisive foramen. To produce topical anesthesia for these injections, proceed in this manner. Betty, tip your head back just a little bit for me and open real wide. Let me retract your cheek a little bit. Turn your head a little to the left. That's it, like that. Hold real wide. Place the cotton tip applicator in this instant in the area of the greater palatine foramen on this side and hold in place, retracting with your finger or retracting with the cotton tip applicator. This is held as before for 1 or 2 minutes, and it is very important in the palatal tissue to burnish the topical anesthetic agent into this tissue. This is the topical anesthesia placement for the left greater palatine nerve. Now close your mouth. This time, Betty, turn a little bit to the right towards me. Open your mouth real wide. Let me pull your cheek and hold your head in that position. The cotton tip applicator for the right greater palatine nerve is now placed in the area of the greater palatine foramen and held in place with retraction. The mouth remains open. Burnishing of the tissue and removal. The long sphenopalatine nerve emerges through the incisive canal and is placed, the topical anesthesia is placed in this manner. Open your mouth again, Betty. Open real wide, relax your upper lip. The papilla lies immediately behind the central incisors. The cotton applicator tip is merely placed into this area and held in position for topical anesthesia with burnishing and removal. An alternate method for this particular injection, as this represents a very painful type of injection behind the central incisors in the palatal tissue. If local analgesia has been produced on the buccal mucosa, you may utilize this for the topical analgesia and merely place the needle through the papilla to penetrate through the papilla to the papilla on the lingual side, deposit a drop of local anesthetic solution, and you have now excellent analgesia of the long sphenopalatine nerve. Okay. I will now demonstrate 2 methods for placement of the cotton roll in the lower arch for injections of the inferior alveolar nerve or the lingual nerve. I will now demonstrate one method of utilizing the cotton roll for topical analgesia of the lower right inferior alveolar nerve and lingual nerve. Turn your head a little bit towards me, open wide just for a second. Let me retract your cheek. The cotton is placed in between the teeth with it penetrating or pushing against the mucosa in the area of the coronoid notch on the anterior border of the mandible, and then ask the patient to bite the teeth together. Close your mouth now and hold it like that. That's good. Now open once again. To utilize the cotton roll for topical analgesia of the inferior alveolar nerve the left and lingual nerve left, place in this manner. Now open your mouth wide. Let me pull your cheek. That's it. Don't turn your head. Bite down now. That's the way. Now open once again. To produce topical analgesia for injection of the long buccal nerve, right and left, place the cotton roll in this manner. Now open. Let me pull your cheek. Place it to the buccal side of the molar teeth slightly so that the patient can engage it in their teeth. Now close your teeth together. It now lies over the course of the long buccal nerve as it comes across the coronoid notch into the buccal sulcus. Now open once again. Placement of the cotton roll for the topical analgesia of the left long buccal nerve. Now open once again. Let me pull your cheek. Don't let me turn your head. Open just a little wider. Now bite right down. That's it. It is now held in place with the teeth against the mucosa in the area of the long buccal nerve. Now open once again. The alternate technique for the inferior alveolar and lingual nerve is to utilize a cotton applicator. It may be done in this manner. Turn just a little bit towards me, open wide, retract the cheek sufficiently, take the cotton tip applicator and hold in the area, now open a little bit wider, in the area of the coronoid notch, retracting with your finger or retracting with the cotton tip applicator. For the left inferior alveolar nerve and lingual nerve, now open your mouth. Don't let me turn your head. Hold it like that. Now open. For topical analgesia of the mental branches, right and left, now open your mouth. Let me pull your cheek. Don't let me turn your head. Place the cotton roll in the area of the bicuspid teeth in the mucobuccal fold and leave in place. Now open. For the left mental branch, now open. Let me pull your cheek. Don't let me turn your head. Okay. Now open once again. At times it becomes necessary to anesthetize the lingual nerve in the anterior segment of the mouth, and topical analgesia may be produced for the anterior segment, right and left sides, by placing the cotton roll in this manner. Now open your mouth wide, pull your tongue, that's it, place this down. Now hold your mouth open like that. The cotton roll is held into the floor of the mouth against the mucosa. For the anterior portion of the lingual nerve left side, open your mouth. Hold it against the mucosa. Okay. I will now demonstrate conventional injection techniques for producing local analgesia of the maxilla. We will start by showing the upper left posterior superior alveolar nerve injection. Ready, turn just a little bit towards me, open a little bit wider. Let me pull your cheek, don't let me turn your head. And to this point right here, you can use the needle as part of the retracting mechanism of the lower lip. The needle is placed posterior to the zygomatic process of the maxilla. In this position here, as much in alignment with the teeth as possible. The posterior superior alveolar nerve injection. We will now demonstrate the middle anterior superior nerve injection. Turn your head a little bit towards me, relax your cheek, don't let me turn your head. The needle is now used as a retractor as well as the finger. This is now placed in the area of the bicuspid teeth anterior to the zygomatic process of the maxilla, passed upwards in a direction parallel to the axis of the bicuspid teeth to the height of the apical portion of the tooth. The anterior superior dental nerve, open a little bit wider. Let me pull your cheek to the side, don't turn your head. With the finger and thumb, pull the upper lip upward in this manner. The needle is placed for this particular injection opposite the tooth that you desire local analgesia. Pass upward to approximately the height of the apical area of the tooth, then removed. For the right side, turn your head just a little to the left, open a little bit wider, pull the upper lip up in the same manner with the finger and thumb, the same direction, axial direction, upward, in line with the tooth that you care to anesthetize for the anterior superior alveolar nerve. Tip your head up just a little bit. Open your mouth a little bit wider. Let me pull your cheek to the side. Don't let me turn your head. Retract with the finger mainly in this position. Turn a little bit to your left. For the middle superior alveolar nerve in the area of the bicuspid teeth, the right injection by placing upward into the mucosa to the height of the apical area of the tooth. Now tip your head up a little bit more, open a little bit wider, close your mouth a little bit, relax your cheek, don't let me turn your head, relax your cheek. The posterior superior alveolar nerve right side, once again, distal to the zygomatic process of the maxilla. Tip your head down just a little bit, that's it, like that. The needle is placed posterior to the zygomatic process, retracting with the finger and the needle in this manner. As we demonstrated for the anterior section of the maxilla, for infiltration of the tissue, you may utilize the opposite sides of the midline. Horizontal type injections will be made in this manner here. Tip your head up a little bit. If I care to infiltrate and anesthetize the left anterior section with topical analgesia to the right of the midline, the needle may be placed horizontally in this position and passed in this direction, submucosal. This avoids contact with the periosteal membrane of the bone and is much more comfortable. If it is the opposite, if anesthesia is desired to produce on the right side of the anterior maxilla, it may be placed in this manner here. Turn your head towards me, open a little bit wider, and that's a bit like that. Retracting the lip with the finger and thumb, passing this from the opposite side in a horizontal direction to lie in this position here. These landmarks can now be demonstrated. The anatomical skull. Once again, the upper left posterior superior alveolar nerve with the needle passing posterior to the zygomatic process of the maxilla, parallel to the tuberosity. For the middle superior alveolar nerve passing in the axial direction of the bicuspid teeth to the height equal to the apical area of the tooth. For the anterior section in a vertical injection passing upwards, this portion, the anterior nasal spine, is often encountered in this type injection and is painful to touch the periosteum in these areas here. The right side of the maxilla, once again, the upper right posterior superior alveolar nerve, posterior to the zygomatic process, the middle anterior superior dental nerve, and the anterior superior dental nerve injections. Once again, demonstrating horizontally for infiltration of the anterior portion of the maxilla, placing in this direction or in this direction, curving to the contour of the anterior maxilla. For injections of the palatal portion of the maxilla, now tip your head back once again. There are three landmarks to encounter: the greater palatine foramens on the right and left sides, and the incisive canal behind the upper central incisors. For the injection of the upper right greater palatine nerve, proceed in this manner. Open real wide, relax your cheek, don't let me turn your head. The greater palatine foramen is located in the vicinity of the second molar tooth, approximately 1/3 to 1/2 the distance from the gingival margin to the midline of the maxilla. Now open real wide. The approach is made in this manner with the mouth very wide, proceeding to the area of the greater palatine foramen, resting on the lower lip and retracting on the lower lip. For the injection of the upper left greater palatine nerve, open real wide, let me pull your cheek, don't let me turn your head. The approach is made from the opposite side to the area of the greater palatine foramen in this manner. For the injection of the long sphenopalatine nerve, the lingual approach, proceed in this manner. Open your mouth, let me pull your cheek and lip up here, relax your cheek and lip, open real wide. It is necessary that the patient maintain a very wide opening for the approach in this direction to the papilla behind the upper central incisors. The alternate approach is to proceed from the labial aspect, utilizing the interdental papilla, passing directly through the papilla to the area of the incisive canal opening on the lingual palatal surface. The same landmarks on the anatomical skull for the upper right greater palatine nerve injection in the area of the greater palatine foramen. The upper left greater palatine nerve in the area of the greater palatine foramen. And for the lingual approach of the long sphenopalatine nerve at the incisive canal, and the alternate method through the interdental papilla to the area of the incisive canal. For injection techniques of the mandible, I will demonstrate first the right and left inferior alveolar nerve and lingual nerve injections. Turn just a little bit towards me, open real wide, let me pull your cheek out, but don't let me turn your head. Place the index finger into the deepest part of the anterior surface of the ramus, known as the coronoid notch, and palpate the coronoid notch. The ridge to the medial side of the coronoid notch is the internal oblique ridge and is a very important landmark for this injection. Palpate the internal oblique ridge. The approach of the needle is opposite the bicuspid teeth on the opposite side, with the first point of reference being the internal oblique ridge. If this ridge is encountered in the injection, the needle is displaced medially with the palpating finger to clear the internal oblique ridge, and then a direct thrust movement back to the area of the foramen is made. The needle is withdrawn in the same plane. For the inferior alveolar nerve and lingual nerve of the left side, now open your mouth. The thumb can be utilized as the palpating finger to feel the coronoid notch, palpating the internal oblique ridge, the approach opposite the bicuspid teeth of the opposite side, the first reference point being the internal oblique ridge. If this is encountered, displace the needle medially with the thumb and continue backward in a straight direct thrust movement. The needle is then removed in the same plane. For injections of the long buccal nerve, right and left, turn a little bit towards me. Let me pull your cheek out. Don't let me turn your head. Tip your head up just a little bit. That's it, like that. Firm retraction of the cheek is necessary for this injection. Now open a little bit wider. That's the way. The long buccal nerve passes across the anterior portion of the coronoid notch into the buccal groove, and the needle may be placed at the midpoint of the coronoid notch to anesthetize the long buccal nerve right side. For the long buccal nerve of the left side, now open real wide. Once again, the thumb is used as the retracting finger. The needle is placed backwards in line with the plane of the teeth to the coronoid notch as the long buccal nerve crosses this area and removed. For the block of the middle branch of the inferior alveolar nerve, right and left sides, now open real wide, just relax your cheek for me. The middle foramen is located opposite the apex of the bicuspid teeth. The foramen passing in this direction. The needle should therefore be placed into the mucobuccal fold between the bicuspid teeth and solution deposited for local analgesia of the middle branch right side. For the middle branch left side, now open a little bit wider, let your cheek be real relaxed. The same landmark, the middle foramen being in the area of the apex of the bicuspid teeth, the needle passed in this direction to come in the plane of the middle foramen. To anesthetize the anterior portion of the lingual nerve, right and left sides, open real wide this time for me. Let me pull your cheek. Don't let me turn your head. For the right side, the needle is passed through the oral mucosa, floor of the mouth, in the area of the first bicuspid teeth to block the lingual nerve as it traverses this area. For the left anterior portion of the lingual nerve, the index finger can be used for retraction, open real wide, placed once again into the area of the first bicuspid teeth through the floor of the mouth mucosa, solution deposited and withdrawn. Didn't see it too well. The anatomical landmarks, once again, on the mandible. The anterior portion of the ramus, the deepest portion being known as the coronoid notch, which is palpated with the palpating finger. The innermost portion, the medial ridge, known as the internal oblique ridge, is the primary point to palpate for this injection. The needle direction is then passed approximately over the bicuspid teeth of the opposite side to the area of the internal oblique ridge. If the ridge is encountered, the needle may be displaced more immediately with the palpating finger and continued backwards to the area of the foramen, approximately in plane with the occlusal surface of the teeth. The opposite side, the left side, being palpated with the thumb in this manner. Once again, to palpate the coronoid notch and the internal oblique ridge. The injection approach is made over the bicuspid teeth of the opposite side to the area of the internal oblique ridge. If encountered, may be displaced medially and continued backward into the area of the foramen for the injection. The long buccal nerve, right and left side, traverses the coronoid notch as it goes into the mucobuccal fold, and the injection approach is made into the area of the coronoid notch to deposit solution this side, right, the left long buccal nerve in this manner here. The mental branch of the inferior alveolar nerve arises through the mental foramen. This foramen's direction is in anterior and forward direction. The needle, if possible, should be placed and presented into this direction to the mental foramen, right side, and mental foramen, left side. The anterior branch of the lingual nerve may be infiltrated in the floor of the mouth on the right and left sides by penetrating the mucosa of the floor of the mouth in the area of the first bicuspid tooth and produces anesthesia, lingual nerve, right and left sides, anterior part, floor of the mouth. The demonstrations you have just seen on topical anesthesia placement and injection techniques for local analgesia of the maxilla and mandible are intended to serve as a guide for anesthetic management of your patients receiving operative and surgical therapy. Review these techniques frequently until their administration is second nature to you. Be understanding of your patients' fears and apprehensions of needle injections, and above all, develop a genuine compassion for your patients' well-being and comfort.